My name is Ben Vacanti. I'm an emergency room registered nurse, and I've been working in the emergency room for 2 years, and I've been a nurse for 3 years total. So emergency nursing is a very special kind of nursing. We get the patients relatively quick. We evaluate them firsthand. A lot of times our patients are coming in with an array of complaints from anywhere from chest pain or a broken arm, and we have to be able to figure out what the best treatment plan is for them. We're able to provide care, help them feel better, provide pain relief, provide medical support to them to make sure that they're doing well. A lot of things go quickly down in our department. We have to work on our toes, be able to evaluate and treat patients relatively quick because things can change very fast. Some responsibilities that an emergency room nurse has is putting in IVs, assessing our patients, placing them on our monitors, obtaining vital signs. We're able to do procedures on patients, not anything very invasive, but we're able to assist with our doctors and other providers. In the emergency department, where we get the capability to see a large population, and we see a lot of different things that come in, anywhere from a patient that has broken their arm, we're able to cast and splint. People who have cuts, we assist with repairing the cut with like stitches. We take blood work from patients, so we're able to start IVs and draw blood work off of their IVs, give them medicine, and just a wide array of different opportunities that we get in the emergency department. So when I come to work, we tend to work either 8 or 12-hour shifts. In the emergency department specifically, we have a nurses station where we're able to see patients that are checking in for various complaints. From there, we have a nurse that is able to talk to the patient, figure out a plan for them, see why they're here in the emergency department, and then they get placed into a room where our doctors and physician assistants will go and evaluate them. So we get to see a lot throughout the days because we never know what's going to walk through the door. Sometimes we get more crazy days where people are coming in with heart attacks and strokes, and other days are a little bit more simple with like, oh, I fell and I hurt my hip. So it's exciting just to kind of come into work and not know what to expect. My inspiration to get into nursing came from my mom. She's a nurse. She's been a nurse for about 35 years now. So I followed right in her footsteps. I always found that I liked helping people, finding ways to make people feel better. And nursing really called to me as I was growing up throughout my life. So she kind of got me a little bit exposed here and there. And as I got older, I was able to do research myself, and I found that this field was a really great opportunity for me to fulfill my need to help people and have a satisfying job out of it as well. I graduated high school in 2016. Right from high school, I went to Genesee Community College. There I studied for about 3 years. I was able to be accepted into the nursing program there after my first year at GCC. The nursing program itself is a 2-year program where at the end of it you get your associate's degree and your nursing diploma. After you complete your associate's degree in nursing, you have to take a very, very stressful test called the NCLEX that will allow you to obtain your nursing license. So everyone is working towards that throughout their college career to pass this very important exam. Once I passed that, I was able to go on to become a nurse, where I started here at the Batavia Hospital. I joined the United Memorial Medical Center as a fellow. I did a special program where they trained me on multiple floors. So I started on their medical surgical floor. I went to their intensive care unit, and then finally I was down in the emergency department. So during that time, I was able to go on and get my bachelor's degree through Brockport. So I went to Brockport online. I was able to complete it in a year due to GCC and Brockport having a great partnership that allowed them to crossover classes and was able to complete my degree relatively quick while working, which was a perfect opportunity for me because it was a time of learning. I was more hands-on. I was ready to get into my nursing practice, and it was exciting for me to be able to do both, go to school and learn hands-on as I was actively working. Rochester Regional and United Memorial Medical Center, the hospital itself, offer some great opportunities as a nurse. I was able to complete my bachelor's degree while working, and during that time, Rochester Regional offered a tuition reimbursement to me, so I was able to successfully complete my bachelor's degree without worrying about having to pay for it. That allowed some great stress relief in my life, just to be able to know that I was working towards a higher education and that I was encouraged to do so by our hospital, just to make sure that we have the best nursing care possible. Last December, around Christmas, we had a patient come in to our emergency department. I was assigned this patient, and I immediately recognized something was not going well. He was very sweaty. He said he didn't feel good. He had a deep pressure in his chest. So I was very concerned about this patient having a heart attack. So immediately I was able to do a EKG, which confirmed that he was having a heart attack. We got our doctor in the room immediately. We were able to give him medications that would help prevent his heart attack from getting worse. And we sent him immediately to surgery to hopefully reverse any damage that he had done to his heart. Oftentimes with patients that are experiencing heart attacks, their surgery that is required is needed to be done in a larger hospital. So we were able to send him by ambulance to Rochester General Hospital, and he was able to get the surgery to help his heart be able to pump better and reverse his heart attack. So that was rewarding to see that I was able to identify that patient, make an impact in his life. The best part about it was about a week later, it was a couple days before Christmas, he and his wife had come into the emergency room and personally thanked me for being so attentive and being able to recognize what was going on with him. He got quite emotional because he's like, I have family, I have many grandchildren, and to be able to spend the holiday season with them this year was wonderful to see, because without him coming into our hospital and us identifying his needs as rapidly as we did, he could have easily had a different outcome. So it was very rewarding to have that experience. Some advice that I would give to any young person that is looking to go into the healthcare field, some things that helped me when I was growing up is I was able to take biology classes, and especially just the opportunity. I'm sure that everyone has someone that they're related to that's in some type of healthcare. Speak to them about their experiences, let them tell you fun stories and different things that they've come across in their career, just to help get exposure to that healthcare mindset, because it's such a vast array of different things, and not specifically just to nursing, but to becoming a doctor or a lab tech, and there's a lot of different aspects of healthcare that it's very inviting, very welcoming, and there's such a high need in our community and world for it that there's always an opportunity for someone that's willing to go into it.